Afternoon class. Today we are looking at drug interactions. Drug interactions occurs when the action of one drug is altered or changed by the action of another drug. There are two ways we have categorized this. One is by agents that when combined they increase the actions of one or both drugs. And then the second one is that when two drugs are combined, either they decrease the effectiveness of one drug or both drugs. So it is either the combination is in favor of increasing actions of the drugs, or the combination is in favor of decreasing the effectiveness of one or both of the two drugs administered at the same time. Uh, Drug-drug interactions can be intended or unintended. Sometimes they occur unintended, and all this impacts therapeutic effects or the adverse reactions that an individual might encounter. So we said some DDIs are well known and avoidable, while others remain undocumented and they are unavoidable. Polypharmacy is common. By the term polypharmacy here, we mean like prescribing so many drugs at the same time that the patient is supposed to take. Okay, these drugs are prescribed. It could be for the same sickness, or it could be for a patient suffering from multiple uh, conditions and is now getting prescription for 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 cure by many different drugs that might be interacting at the same time and also impacting on each other. So this involves multiple drugs for a single disorder, or different drugs for multiple disorders. We also have what we call the over-the-counter drugs, OTCs, and prescription medications. So the over-the-counter drugs are those drugs that have been licensed by the Food and Drug Authority in the country, where they can be easily accessed by the public. Okay, anyone can go and ask for it, and they can be given without the need of the prescription of a doctor. Okay, while there are those prescription drugs that they are really restricted, they are not supposed to be given in any outlet, whether it's a drugstore or pharmacy. They only need to be given when there is a prescription by the doctor. So substances like also caffeine, nicotine, and alcohol, these ones can also interact with prescribed medication. So actually, in addition to drug-drug interactions, also we should not forget the other substance and their effect on these drugs. Okay, caffeine, nicotine, alcohol, but also as well as some nutritional supplements. Um, some drug interactions are beneficial, such as the use of caffeine, which is a central nervous system stimulant, with an antihistamine, which is a central nervous system depressant. So this point is telling us that some interactions produce the intended benefit that we want. For example, if somebody is taking a caffeine, we know caffeine is a chemical substance that has some impact. It acts as a CNS stimulant. Okay, it stimulates. You become alert. You take some coffee and you feel like you are getting more alert and able to concentrate now with your studies or the work that you are doing. So when we combine this with an antihistamine, which is also a central nervous system depressant, um, all this all this will produce like a beneficial effect. The stimulatory effects of caffeine counteract the drowsiness caused by antihistamine without eliminating the antihistaminic effects. So this is how it interacts. It counters each other to produce beneficial effects. The mechanism of drug interactions can be categorized as those that change the absorption, distribution, metabolism, and excretion of a drug, and those that enhance the pharmacologic effect of that particular drug. Uh, let's look at drug-drug interaction consequences. We said the consequences are varied. One, we might have increased therapeutic effects. We have an example to that is if we combine a drug called sulbactam, which is a combination of a chemical component called sulbactam, and then combine with the ampicillin, our extended spectrum penicillin. Ampicillin is one of the extended spectrum penicillin. Uh, This combination inhibits the bacterial action, the bacterial enzymes, therefore enhancing the action of ampicillin. It makes the drug more um, active against the bacteria because this sulbactam is supporting along the line. It inhibits those bacterial enzymes that might produce harmful effects. So this is really an increased therapeutic benefit, and that's why we combine these drugs many a times so that we can counter really the strategies used by bacteria to resist the treatment that we are giving. We have reduced therapeutic effects. Example is the drug called albuterol. We know this drug is commonly used for asthmatic uh, patients as it dilates the bronchi and therefore opens up the airway. So propranolol, which is used for hypertension, also counteract its effects. Okay, so if we give a person who is a bit asthmatic and maybe perhaps also is already hypertensive, we give albuterol at the same time we also give him propranolol. These drugs counteract their effects, uh, and therefore we may not one drug may not be able to produce the intended effects the way we expect because of the action of the other against it. Sometimes the consequence can be reduced adverse effects. The example here we have naloxone. This drug blocks actions of morphine. We know morphine is a pain modulator, one of the strong pain modulators. And when they are administered together with naloxone, this one blocks the effects and thereby reversing the morphine toxicity. Okay, so it counters the adverse effects of toxicity caused by morphine. We can have increased adverse effects. The example here is if we use warfarin, which is an anticoagulant, okay? Maybe somebody uh, at risk of developing maybe deep vein thrombosis because of venous stenosis, and then we are administering this person warfarin because of coagulation disorder. And at the same time, if this person is also taking aspirin, which is also an anti-clotting agent. So you see, we are given an anti-clotting agent, also an antiplatelet agent. All these drugs are acting along the same line. So this will lead to elevated risk of spontaneous bleeding because their action is really is in favor of a bleeding scenario. So this will bring increase adverse effect because they will be acting in the same direction. We said drug and drug interactions also change the pharmacokinetics uh, in the four different ways. They alter the absorption, they alter the distribution, they alter the metabolism, and they can also alter the renal excretion of this particular drugs. Example, altering absorption, we said antacids can reduce the absorption of ketoconazole in the stomach. So, for example, the drug ketoconazole needs the acidic medium in the stomach. You know, the stomach contains the hydrochloric acid, and when we swallow this drug, on empty stomach, actually, it's a good media that dissolves this drug quickly. But in a situation where someone is maybe already suffering from peptic ulcer disease and is already taking those antacids, trying to reduce the pain caused by the ulcer, but also at the same time, this person might be treating him, we might be treating him or her for a fungal infection that we are giving him ketoconazole, and all these drugs are taken at the same time. There will be a reduced absorption of this ketoconazole because the acidic media will have already been countered by the antacids to make it a bit alkaline. So this is how absorption can be altered. Example of drugs that can alter through absorption. Now let's look at through distribution. Okay, competition for protein binding can increase plasma levels of the free drug. So for the distribution, normally we look at how this drug is moved through the body, and most of these some drugs are carried through a protein binding. An example is we have pyrosemide can displace warfarin when administered together, therefore increasing the warfarin effects. Okay, so remember we said that the most active form of the drug is the one that is displaced from its binding sites. Okay, So when a drug is bound to a protein, to a carrier protein, it is inactive. But when it is displaced from the binding protein and then it becomes active, this is the amount of drug that uh, the body will use to reach the bioavailability. So what happened here is that when pyrosemide is administered together with warfarin, pyrosemide goes and displaces warfarin from the protein binding and thereby increasing the effects of warfarin. Okay? Again, let's look at how interactions change with altered metabolism. Certain medications can induce or inhibit the cytochrome P450. These are the liver hepatic enzymes that are responsible for the metabolism of many uh, drugs that we take. Okay, they are responsible for metabolizing other drugs. At the same time, these drugs are also responsible for metabolizing many of the toxic drugs, including even alcohol. You know, and sometimes the difference in these particular enzymes also manifest the difference in different individuals, where some people expose to similar certain quantities, equal amounts of alcohol that they are taking might not show drunkenness at the same level because we have variation in our cytochrome P450 enzymes. So all this works a bit differently in one individual compared to the other. Example you're giving here is like erythromycin inhibits theophylline. We know erythromycin is an antibiotic. Theophylline is an anti-asthmatic drug. So if these two drugs are given together, erythromycin has the impact of inhibiting theophylline and therefore increasing the side effects uh, thereafter. Again, let's look at renal expression. Example we are seeing here is um, the drug acetazolamide increases the absorption of quinidine. Quinidine is another drug that's used in cardiac arrhythmias. So in the renal tubules, this one increases the quinidine effects. So this one affects acetazolamide is a drug that works at the kidney tubules, and what it does is it increases the absorption of this drug quinidine, making the kidney tubules more permeable to absorb the quinidine, and therefore less of this drug is cleared in the urine and then more of it is retained instead into the bloodstream, thereby at the end it ends up increasing the effects of this drug. It sustains this drug for long in the body just because of the action of this acetazolamide being administered together with quinidine at the same time. How do we minimize adverse drug-drug interactions? We said we can use a few drugs as possible to reduce the potential for interaction. Okay? We can give one drug after the other, or we can monitor the durations and give them in varying intervals. We can also conduct a comprehensive drug history, considering over-the-counter drugs, or if this person is an alcoholic or he's taking other illicit drugs. And then we take all this into consideration, or even other natural healthy products. We can adjust the dosages when adding or removing drugs that induce or inhibit metabolism. We can also look at the timing, okay, time the drug administration to minimize interference with absorption. We also monitor for early signs of toxicity when in combination of toxic agents so that they can be avoided. Exercise extra caution when the patient is taking drugs with a narrow therapeutic range. So, drugs with a narrow therapeutic range means those drugs that a small alternation in the required dosage may easily cause adverse reactions. Okay, narrow therapeutic window. That's what it means. And as we shall see, certain drugs have narrow therapeutic window as compared to others, such that any exaggeration of the dose, any bypassing of normal dose by a small quantity of milligram already expose the patient to severe adverse effect, while others have a wider therapeutic window where even if there is an overdose, the person doesn't get immediate adverse reactions. Now, let's look at food and drug interactions. Very important. Foods can impact drug absorption, leading to reduce or increase drug effectiveness. So many a times it's important to follow exactly what the pharmacist or the dispensing chemist will tell you, because already they are well versed with this food, which particular foods interact with which particular drugs, which drugs should be taken after food, which drug you need to take on empty stomach. Okay, all these have importance in reaching the therapeutic goal. Example we are looking here, we say tetracycline antibiotics effect is reduced by milk products due to calcium forming insoluble complexes. So you see here, somebody is taking milk at the center is taking tetracycline. What happens is that tetracycline, there is the ring, there's a chemical ring of the tetra group of the tetracyclines. It forms a chemical compound that interacts with the milk and forms insoluble complexes. So actually, this will have already affected the absorption of this particular drug. Another important one not to forget is grapefruit. I like to talk about this because many a times our patients are sick in the hospital, and then many people come. They are coming to visit, coming with a lot of drinks, grapefruit, mango juice, whatsoever. But actually, grapefruit has a chemical that is called naringin. This is one of the biochemical constituent found in grapefruit that also inhibits metabolism of certain drugs and then increasing their blood levels. So you'll get to check which particular drugs interact with naringin, so that if this person is taking this particular drug, at least if we are giving kind of juice, it shouldn't be the grapefruit one. Maybe it should be something else that does not have the naringin, that will never interfere with the absorption of this particular metabolism of this particular drug. Impact of food on drug toxicity, we are still continuing. We said interaction between, they said, drug called monoamine oxidase inhibitors. This is a group of drugs, and MAO. MAO means monoamine oxidase inhibitors. We shall see this more when we shall be dealing with the CNS drugs. It is an antidepressant drug actually, and certain foods or medications can cause life-threatening blood pressure elevation. They end up raising the blood pressure. Patients taking monoamine oxidase inhibitors must avoid certain foods strictly. These foods will have to be specified. Certain combinations like theophylline, an anti-asthmatic drug, plus caffeine can lead to excessive central nervous system excitation. We already talked about this as a previous example. Caution is needed with combinations such as potassium sparing diuretics, okay, like the spironolactones and then plus the potassium containing salt substitute. So we need to take caution also while administering these particular drugs. Dietary supplements can interact with conventional drugs, affecting their efficacy or increasing toxicity. There's what we call St. John's wort, which is a herbal form of antidepressant drug. This one can reduce the effectiveness of digoxin. Digoxin is a cardiac stimulant. It's a drug that we always use in patients with heart failure because it increases the contractility of the heart and supports the contractility activity of the heart. So we shouldn't give this herbal antidepressant together with digoxin, because if we are treating a patient already with heart failure, whom we are giving digoxin to be able to reinforce the contractility of the heart and prevent further heart failure, and we are giving together with this herbal depressant, it will be countering the effectiveness of this drug, and that means we will not be getting the improvement that we need in this particular patient. Reliable information about the drug, like dietary supplement interaction, is often lacking and emphasizes the importance of caution. In conclusion, we said drug interactions, whether intended or unintended, can significantly impact treatment outcomes. Awareness of potential interactions and careful management can help minimize risk and improve patient safety. Regular communication with healthcare professionals is essential for understanding and avoiding the drug interactions. So many a times, you sometimes need to spend time with even the leaflets that comes with the drug from the manufacturer, because sometimes some of these persons are already part of those leaflets, because it's a way of trying to guide the prescribing physician and also to be able to guide the patients accordingly. With this, we have come to the end of this lecture. Thank you so much for being with me, and see you in the next.